Hello, my name is Andrew Wenthy, and today I'll be presenting on an immune-mediated disease of the central nervous system known as multiple sclerosis. We'll cover the terminology, neurobiology, genetics, clinical presentation, diagnostics, and treatment strategies. Throughout the presentation, I'll be referring to figures to illustrate key concepts. So this disease primarily affects the central nervous system, including the brain, spinal cord, and optic nerves. It occurs when the immune system mistakenly attacks the myelin sheath, which is the protective covering of nerve fibers. This attack disrupts normal nerve signaling, and understanding the disease's mechanisms, and treatment is essential to improving patient outcomes. So before we dive deeper, here are some key terms you need to know. Demyelination refers to the loss of myelin sheath around nerves. Oligodendrocytes are the cells that produce myelin in the CNS. Axons are nerve fibers that transmit electrical signals. A lesion is an area of tissue damage. A relapse is a period when symptoms worsen or new symptoms appear. Remyelination is the repair process of damaged myelin. As you can see in the diagram, demyelination disrupts the normal flow of nerve impulses, which explains many of the clinical symptoms we'll discuss later. So the disease primarily targets CNS white matter, which includes the brain, spinal cord, and optic nerves. The immune system, including T cells and B cells, mistakenly attack myelin, leading to inflammation and axonal damage. This demyelination shows nerve conduction and can eventually lead to preeminent disability if left untreated. So here you can see immune cells attacking the myelin sheath. Lesions tend to appear in periventricular areas, the spinal cord, and the optic nerve. This explains why symptoms vary depending on the lesion's location. So genetics play a significant role in disease susceptibility. The most strongly associated gene is HLA-DRB1-1501, although many other genetic genes contribute to immune regulation. Environmental factors interact with genetics to trigger disease onset. Common triggers include Epstein-Barr virus, infection, vitamin D deficiency, and smoking. And here's an illustration of human chromosome 6 with the HLA gene. So clinical presentation and pathology. Symptoms depend on where lesions occur in the CNS. Motor symptoms include weakness and spasticity. Sensory symptoms include numbness or tingling. Visual symptoms include optic neuritis. Cognitive symptoms affect memory and attention, and fatigue is very common and disabling. Autonomic symptoms can affect bladder and bowel function. Most patients experience a relapsing, remitting pattern where symptoms flare and then partially or completely improve. So as you can see from this image, lesions in specific CNS regions correlate with these symptoms. So MRI is the main diagnostic tool. The T1 weighted images show black holes, while T2 weighted images show hyper-intense lesions. Gadolinium contrast highlights areas of active inflammation. Cerebral spinal fluid analysis can detect oligoclonal bands and an elevated IgG index indicating immune activity of the CNS. And you can see that illustrated here. evoked potentials, including visual, somatosensory, and brainstem auditory tests, measure conduction delays in affected pathways. The McDonald criteria are used to establish the diagnosis by showing dissemination of lesions in time and space. And again, this slide shows what the oligoclonal bands in cerebral spinal fluid of a normal versus abnormal patient. So for management and treatment has several layers. Disease-modifying therapies reduce relapses and slow progression. These include interferons, glatiramer acetate, oral medications, and monoclonal antibodies. Acute relapses are treated with high-dose corticosteroids or plasma exchange. Symptom management targets spasticity, fatigue, pain, and bladder or bowel disease. Rehabilitation includes physical, occupational, and speech therapy to maintain function. Emerging therapies focus on remyelination, neuroprotection, and stem cell research. So here's an image showing symptom management for multiple sclerosis. They have physical therapies, assisted devices. We discussed bladder and bowel management, other medications, and alternative medicine. So in conclusion, this immune-mediated disease damages the central nervous system, myelin, and axons. Early diagnosis and use of disease-modifying therapies improve long-term outcomes. Multimodal care and use of disease-modifying therapies improve long-term outcomes. Combining medication and rehabilitation is essential for maintaining patient quality of life. Understanding the disease's mechanisms and treatment strategies is crucial for improving outcomes and guiding future research. And here are the references that were used to create this PowerPoint slide, as well as what were used in the paper that I created. And that concludes this presentation on multiple sclerosis.